An annual survey by the Canadian Medical Association shows many doctors report being burned out and exhausted. More than 4,000 doctors responded to the questionnaire. 6 in 10 say their mental health has worsened since the beginning of the pandemic. Nearly half say they've screened positive for depression, with a quarter experiencing what they call severe anxiety. CBC's Megan Fitzpatrick is going through the numbers.
Well, these are pretty troubling numbers, according to the Canadian Medical Association. I mean, the main theme here, Suhanna, is that the well-being of physicians in this country has been deteriorating over the last couple of years. Let's take a look at some of the key findings that really jump out from this report, including that 60% of physicians and residents indicate that their mental health has worsened since the onset of the pandemic. Also, nearly half of the respondents have screened positive for depression, and that's up quite a bit from the last survey they did in 2017, when it was just 34%. Another key finding is that 25% of the respondents said they experienced moderate or severe anxiety. Also, more than half of them, 53%, experiencing high levels of burnout. 49% are considering reducing their clinical work. A lot of them reporting high administrative burden too, just on top of the work that they do in their clinical practice. There's a lot of paperwork they have to do at the end of the day too, and that adds to their workload. And a very high number, Suhanna, 78% reported experiencing harassment and bullying while on the job. Now, the report also touches on what can be done about improving the well-being of physicians in this country, and it talked about some of the barriers to that. And Dr. Christopher Lavos earlier on CBC News Network spoke about some of those challenges as well. Take a listen to what he said about it.
I think there is, quite a bit of stigma regarding mental health amongst physicians. At least there is, a general reluctance to admit that you need help. I think there's a general reluctance to seek out help, because I think there's I think a lot of people are also afraid that if you do that, that might affect your licensure, getting your license renewed. It won't, but that perception, I think, still exists, and it's still sort of limits people's willingness to say, I need help. And also, it's very hard for people to take time off work. It's very hard for people to take time off work for mental health issues, because often there's nobody that can replace you, and you feel bad for leaving your colleagues in a lurch, for leaving your patients.
So they need to take time off, but they can't take time off, and it's kind of a vicious circle, Suhanna, according to Dr. Christopher Lavos. But the report also saying there is some positive positive indications that the culture is shifting a bit when it comes to more doctors seeking help to improve their well-being. And it said that younger physicians are more likely to reach out for some kind of support than their older colleagues, but still under half reported seeking some kind of support, whether it be from their own doctor or a psychologist or other support programs, that they hadn't been accessing those services that do exist in the previous couple of years.
And what's the CMA saying about the results, Megan?
Well, they say that they underscore how dire things are for doctors working in this country right now. They're saying that moving forward, the survey will be instrumental in advocating for physicians and making meaningful changes to the culture of medicine. And they're also saying in the coming months that they'll take a deeper dive into these numbers to try and really get a better handle on what the root causes are for this burnout, the stress, the anxiety, and then really focus on what some of the solutions can be to tackling these challenges, Suhanna.
That's CBC's Megan Fitzpatrick in Toronto. And for more insight on the survey, I spoke with Dr. Alika Lafontaine. He is president of the Canadian Medical Association. He says the numbers make clear the stresses on doctors are increasing.
This is the only national survey for physicians across the country that is done on a regular cadence. And so if you compare the results of this survey to the last one, we do see a worsening of the stats. We also see what I think might be framed as an acceleration of some of these problems. And, the resilience of healthcare workers is always a very late sign for stresses in the system. And so it is important for us to look at this and other data that points towards the same sorts of things. It's more important than ever for physicians to see patients and what they're experiencing, but then also for patients to see what we're experiencing within the healthcare system. Burnout can really be equilibrated to, the stresses that you experience at work. And we're very resilient people. in the healthcare system, but everyone has their limit, and we've reached and passed that several times in the last few years. So there are immediate solutions that I think the federal government and provincial governments can take now. Focusing on creating that space for people to connect with their physician again. We sacrifice so much to get into medicine. What we really ask to get out is that connection with patients. That is the most healing part of practicing as a physician, even though you're in the midst of stress. The second is making sure that we support family practice in particular, through incentives to make sure that offices can stay open. That can be fiscal and otherwise. And then just making sure that when we're looking at the experience of a person coming to work, just like any Canadian would expect, that you don't have acute stress every single moment of every day. And I think that's the lived experience of a lot of physicians across the country right now.
That is CMA President Dr. Alika Lafontaine in Edmonton.